To put your mask on, what you need to do is bend it slightly in the front there where you can see there's just a small gap in the plastic visor, and just give it a little bit of a shape like a nose. Pop that on your nose, tie that to the top of the crown of your head. If you tie it too low, so if you tie your mask down here with your tape, you'll find that your mask will actually fall off your face. Then spread out that piece and tie this piece into the back of your head there. All right? And again, if you wear glasses, sometimes you can just press this piece on so that it's not fogging. Make sure that you've got a little gap out the side here so that when you're breathing out the side, because if you breathe up, you'll see that the mask fogs, and we don't want the mask to fog while you're scrubbed. Okay, so we're about to scrub for a surgical procedure in an operating theatre. If you look in the literature around scrubbing brushes, the first thing that you'll find is that there's no clear evidence about whether we should be using a scrubbing brush or not. What is evidenced in the literature is that if you have soiled hands, or if you have dirt under your fingernails, or for some other reason you need to remove soil from your hands, then you should be using a scrubbing brush. The other train of thought around the scrubbing brush is that if you use it vigorously on your skin, is that you actually make it very rough and allow your normal commensal that's sitting in your layers of your skin to actually rise out of that skin. So if you're going to use a scrubbing brush, don't be too abrasive with it. Really what we're looking to do with the scrubbing brush is remove any of the visible soil from under your fingernails, around your cuticles, and if you've been in the garden on the weekend, you know, we want to remove some of that dirt and bacteria that's there. So before you actually start to scrub, what you'll need to do is open the brush. When you open the brush, you'll see that there's a small green stick in there, and once I've got the actual contents on my hands of the detergent, I will be able to use that to remove the soil or the dirt if I was gardening on the weekend. So I'll just pop it there. Okay, so what we need to do is to wet our hands. And we now can't actually touch anything with our hands. So what I'm going to actually do is turn the tap off so that you can hear what I'm saying. So you can see for the amount of soap that I've put on my hands, it's not going to be enough, all right? So we're going to need, so you need to work out in the facility that you're working in whether one squirt gives you a big amount or gives you a small amount, because you do need a reasonable amount of soap product on your hands. Now there's lots of different types of soap products. There's the brown one that you'll actually see me use on the scrubbing brush. There's a pink one, which is a Hibiclens base. There's sometimes a white one and sometimes a green one. So my important message around the product that you use is not the colour of it, but what it actually contains and what's in it. Once you start scrubbing with a detergent, it's best not to change that detergent for the whole day unless you have a reaction to it. So it's good to know what you're going to do in terms of a reaction to it. So as you can see, at the moment, I'm rubbing fairly vigorously over my hands, over the backs and in the sides. The other thing you'll see scrub nurses do is actually through here. So we want to remove any of the bacteria that's sitting down in this area here. And one of the other things you will actually see theatre nurses do is to rotate round here. And so what we actually do is to make sure that we are removing the bacteria, excess bacteria, from our hands. All right? And then the other thing you need to do is around your wrists. Really important that you go around, not up and down. All right? So my message is round. When you're scrubbing, everything goes round. Alrighty, so we've done our first little wash, and I would have timed that. It's up to you whether you use hot and cold, just cold. Lots of people use all sorts of different temperatures. You don't want it too hot so that you're burning yourself, because when you're scrubbing all day, it does really affect your skin in terms of your own health. So when you put your hand under the tap, what we need is to make sure that the water runs away or straight off. So this is the correct way to get the water to run off your hand. You can see it hits my hand or arm and goes straight into the sink. If I run it this way, put my hand down, all the water's running back. So therefore you've got bacteria heading back into the area that we actually want to clean. So just drop your elbow a bit, run it that way, or lots of people will run it straight off like that. Just move your arm through slowly and allow the soap to come off. You can rub your fingers together on the one particular hand. And by rotating your hand, you can actually remove the suds. All right, we'll move to how to use a scrubbing brush. So I pick up the scrubbing brush, again, not touching anything outside of that space. If I needed to use this piece, if I'd been out in the garden, I could remove the dirt from under there. I haven't been out in the garden on the weekend, so there's no need for me to do that. The scrubbing brushes come in all different types and sizes. And you can see on this one that we've got a piece of sponge on one side and fairly a soft bristle on the other side. So if you wanted to, you could use this part. Now, you can see I nearly dropped it, but I've saved it. Otherwise I had to go and get another one. So you can see some people go round, some people go up and down. But all we want to do is use one part of the brush. So I'm actually using the sponge side. And what I'm going to do is switch across to the bristled side to do my nails. All right, because what we want to do is remove all of the loose bacteria that's sitting inside our cuticles and our nails. So instead of sitting at home on the weekend doing your nails, what we're actually doing is doing them here on the week, here in the actual scrubbing sink. Again, it doesn't matter whether you go round and round or up and down, but what we're looking for is the time that you spend on each one. All right, so you would want to spend about 30 seconds on your nails, just removing all the excess. And then if I wanted to, I could use this over anywhere that I might have rough or callous skin. My hands are pretty good. I haven't been in the garden, and a computer doesn't tend to give me too many callous spots on my hand. So if you were timing this, I don't have a clock here with me, but I would spend about a minute making sure that I have removed all the extra debris, dead skin, excess bacteria. Okay, once I've finished that, I would drop this into the bin. Alrighty, great, that goes. And then again, we turn on the tap, not touching the taps with our hands. So you learn to become very dexterous actually with your elbows. Okay, so again, just making sure that the water is running straight off or away from the area that we're trying to clean. So it's just about rotating your hand. And again, we've got the water heading towards my elbow. You really want to get the soap off your hands. There's no point putting your hands into the gloves. It's quite irritating to your hands in that glove. So it is important for your own skin care that you do remove all of the suds and the soap from your hands. A day of scrubbing and you leave soap on your hands will begin to break down and you won't be able to scrub tomorrow. All right. Okay. So happy that we've done my hands. So now what we need to do is go back and again give the hands another bit of a wash because we have used the scrubbing brush and removed all that extra skin. And you're probably thinking to yourself at this point that I am mixing my detergents. You are absolutely correct. The brush that's here on the Rockhampton campus is a betadine base, but you'll see that the actual one that I'm using out of the dispenser is not a betadine base. So if I was in the operating theatre, I would use a totally betadine based detergent, but I don't actually have it here with me today. So if you could just pretend this one's brown, that would be fantastic. Okay, I've done the hands, happy that they're all... So now we want to move down the arm. So it's a rotation. Some people will do small, like little, but you can't do this one, all right? You can't go from here, because this is the least clean to the more clean, okay? So when you're doing this, you need to be conscious and thinking about where's the more clean area. This bit is the more clean area. This is the less clean area. So once I start heading towards the less clean area, I can't go back to the more clean area. So if you're going like this, that's exactly what you're doing. You're dragging the bacteria from here back into a space that you've already cleaned. All right, so that's the logic behind what we do inside of a theatre. So again, I move down because I need to go all the way to my elbow. And for me, I'll quite often go round like that, and I'll go round like that. So that's one arm. And again, I've run out of suds, so it doesn't matter how many times you go back for suds. Just need to make sure that your hands are well covered with the soap or the detergent that's in the actual product. Again, I tend to go round, and I use a mixture of techniques to make sure that I have removed, because most of you will have done the glow light test way back when you started in this bachelor degree, and you can remember then how much bacteria was actually sitting in your webbing, in the joints, and actually sitting in your wrists. So it is important that you spend a reasonable amount of time in these areas. And I usually have a large clock that I'm looking at, and so I usually time how long. So for me, I would spend 30 seconds to a minute on each of my arms. But you do need to go all the way to your elbow, hence why theatre nurses' shirts only come so far. And the other thing you might want to do when you first have a practice of this is roll your sleeves up, all right? I've been doing it for 25 years, so I don't tend to get wet sleeves now. But if you wanted to, you could certainly roll your sleeve up. Okay, we're going to turn the sink on. And again, making sure that the water runs away. And you can go in and out of the water, but make sure that the water runs away from the cleanest area. This is the part where you usually get your sleeves wet, so don't turn the tap on too fast, and you'll see that the water's only going so far up. If I wanted to, I could check. If I needed to go back, you can rotate your arm back through the sink. All right. And you'll find that you do drip water on the floor, but you'll see that we actually have a non-slip mat here, and that's why it's really important in an operating suite that you do have non-slip footwear on. And most staff will wear clogs or gumboots. So sometimes you can just check whether you've got and you can see that I've actually still got some soap left on this hand, so it's going to need to go back in. Okay, and so then we'll just do our hands one more time. Now when you go into the operating theatre, you will see many variations on what I've just done. But I want you to think about the principle of the actual scrubbing technique, all right? So we're talking about areas of most clean, because you can never actually make yourself bacteria-free. To be bacteria-free or aseptic, you would need to put yourself into a steriliser, heat yourself up for 3 minutes to 100 degrees, therefore killing any bacteria or spores. We don't want to do that to anyone, because it's not good for being inhabited with life. So what we've got to think about is minimising the amount of bacteria. So our role as a scrub nurse is to minimise, to the best of our ability, all of the bacteria that's on our hands. And again, it's a fairly vigorous rub. It's not a party rub. It's not like you're home washing your hands after you've wiped something down. You can see it's quite vigorous. And I always do my wrists again. Better than going to the gym, really. Okay. I'm just going to turn the water down a bit so that we don't end up with it out the sink. You do want to try and contain the water in the sink. Okay, we'll let it drip a little bit and then we're going to head off to show you how to pop a gown on.